inclusive healthcare according to WHO, it consists of accessibility to nutrition, accessibility to clean water, accessibility to sanitation, and availability of trained medical professionals. These are the four criteria that WHO establishes, the World Health Organization, that if a country has these four criteria met, then they are having inclusive healthcare. All right, accessibility to nutrition, accessibility to clean water, accessibility to sanitation, and availability of trained medical professionals. So these are the four criteria that they list. Now, to achieve inclusive healthcare, two types of targeting of health are generally suggested. One is preventive healthcare, don't let the disease happen. And the other is curative healthcare. If the disease has happened, cure it faster and cure it on a more permanent basis. All right. So two type of healthcare mechanisms are suggested. Two types of healthcare mechanisms for inclusion. One is preventive healthcare, that is restricting the disease, and another is curative healthcare, that is faster and stable treatment. So these are the two lines of defense that people generally tend to use when we say there is a healthcare issue. All right, that if you talk about healthcare, so I'll take you into them one by one. So first we talk preventive healthcare. So think, when we talk about preventive healthcare, the method of preventive healthcare is, or the mechanism of preventive healthcare is, you can give people vaccination, you can make sure that people are nutritioned well, we can make sure that there is proper sanitation and proper facility of clean water and so on. And apart from that, we can make sure that there is information network to inform people about the spread of what is called non-communicable disease. For example, things like cancer or high blood pressure or diabetes and so on. All right, so if you can inform people about that, again, you restrict many of these diseases from happening. So that is prevention. So I'm taking you into that. You write below this. Preventive healthcare can be practiced by spreading vaccination comma, promoting nutrition, comma, provision of clean water, provision of clean water, comma, providing sanitation facilities, providing sanitation facilities and spreading information to prevent the spread of non-communicable disease. Spreading information to prevent the spread of non-communicable disease like type 2 diabetes, comma, hypertension, comma, cancer, obesity, etc. Okay, so that is one aspect, that you prevent disease from happening by these methods, and India needs it very badly for a very important reason. See, the countries which are well developed today also used to face particular type of disease when they were underdeveloped. So Europe or even US will have their bouts of cholera or malaria or tetanus, plague. तो ये चीज़ें उनके यहाँ भी होती थी in 17th century, 18th century, and people would die in droves. But as they became rich and they sanitized themselves better, they became more nutritious, and they could prevent these kind of disease from happening. So that is, these diseases were gradually named as the poor man's disease. कि जब आप गरीब होते हैं तो आपको ये सब disease होती हैं, क्योंकि आपके यहाँ vector borne disease होंगी, bacteria होंगे, and so on. जैसे लेकिन ये अमीर हुए, पैसे बढ़े, तो फिर इनके यहाँ नए तरह के डिजीज आए जिसे कहा गया रिच मैन्स डिजीज, द नॉन कम्युनिकेबल वंस, हाइपरटेंशन, डायबिटीज एंड सो ऑन एंड सो फोर्थ. सो दैट वाज कॉल्ड द रिच मैन्स डिजीज, कि आप जैसे अमीर हो गए तो आपको ये सारी डिजीज सामने नजर आने लगी, ऑल्सो लाइक ओबिसिटी एंड सो ऑन. In India, we have not yet been able to overcome our poor man's disease. So if you look at the incidences of tuberculosis or incidences of dengue or meningococcal disease, or even typhoid, these are still pretty high in India. But on the other hand, we also see very fast increase in what we used to call the rich man's disease. So when it comes to type 2 diabetes or hypertension and so on, again the numbers are very high. So we have to fight on two fronts, which not many countries have done in this world. You understand that the developed ones would first fight their poor person's disease and then fight the rich person's disease. So they had one place to fight at. We are fighting at two places at the same time. So it is very important that we prevent as many diseases from happening as we can. Apart from that, there are three economic advantages of preventive healthcare. So the economic advantages of preventive healthcare is, number one is that it reduces people's out-of-pocket expenditure on healthcare. So when you reduce people's out-of-pocket expenditure on healthcare, you can save many people from going into poverty. I'll tell you what I mean. Suppose I'm someone who is pulling a rickshaw, or I'm working as a daily wage laborer, and working hard I have been able to take myself out of poverty. I was earlier very poor, now I am comparatively better off. But then I get ill, and then maybe I lose my health for 3 weeks or 4 weeks, and I have to spend a lot of money to get myself well. So I lose my job and I lose my savings, and that pushes me back into poverty. So if we can practice preventive health care, that's one thing we can stop from happening. Another benefit of preventive health care economically is that it saves labor hours lost. When people go unwell, of course, they cannot work. And if they cannot work, that's the loss of labor hour of that day. All right, so it's labor hour lost. And the third benefit of preventive health care is that once you have done this preventive health care, or you have done the prevention, you can make sure that those who are going unwell can be treated better, because of less pressure on the existing healthcare infrastructure. COVID pandemic में ज़्यादा बड़ा problem क्या था? That the pressure on existing healthcare infrastructure had been so much that we could not treat even normal things. The shortage of oxygen and shortage of hospital beds, so that was because of the huge burden on the healthcare infrastructure. So this is something that we need to work upon and go back. And if prevention can be done, that is something we can take care of. So this is what I'm making you write now. You write, preventive health care can provide the benefit. Preventive health care can provide the benefit of benefits of one, restricting the number of people falling in poverty by reducing out-of-pocket expenditure. Reducing out-of-pocket expenditure. Out-of-pocket expenditure is the expenditure done by people from their own account to get themselves treated. Like there can be expenditure done by the government to get people treated, and there can be expenditure done by people to get themselves treated. Now, out-of-pocket expenditure is the expenditure that people have to do from their own pocket to get themselves treated. Now, in India, till 2016, the out-of-pocket expenditure, out of total healthcare expenditure, used to be 65%. Now, in 2016, we introduced a scheme, and I'll make you write that in the next discussion. That was called Jan Arogya Yojana, PM Jan Arogya Yojana. And in PM Jan Arogya Yojana, the households were given a 5 lakh rupees insurance per family per annum. And that has reduced, that is one factor. There are other factors also, but that is one big factor, which has reduced the out-of-pocket expenditure from 65% to 48% in our country. So that is again quite an achievement to some extent, that we have been able to bring the out-of-pocket expenditure below 50% now. The target should be to make it not more than 25-27%, that 3/4 of the expenditure can be taken care of by the system, and 1/4 maybe people have to do one thing. So this is the long-term target to achieve. Okay, then you write below that, second point, it reduces loss of labor hours, HOURS hours, due to illness. Then you write third, it allows better treatment by restricting pressure on existing healthcare infrastructure. All right, there is preventive healthcare, and then there is curative healthcare. So curative healthcare has again 2-3 facets to it. Number one, have good diagnostic tools so that the disease can be diagnosed faster. All right, if you can diagnose it quickly, you can treat it quickly. So good diagnostic tools. Number two, make sure that you have enough number of doctors and nurses, the medical staff, to take care of people. Along with the healthcare infrastructure, good number of primary healthcare centers to detect the disease, maybe give initial treatment, first aid, etc. Secondary healthcare centers to maybe provide people with, if they need drips or if they are suddenly suffering from some disease, and then tertiary healthcare centers for complex operations or complex treatment, and there should be a network of that at affordable price. Now, affordability of price can be done in two ways. One is create a network of public healthcare system. So spend money on public healthcare. There can be state hospitals, there can be central government funded hospital, there can be municipality hospitals, and fund them well, give them good resource, and make sure that they function better with enough amenities. Apart from that, the other method is, or along with that, the other method is provide insurance to people for health. So when you provide health insurance to people, it assures that even if somebody is not very well to do, they can get some quality health care because of the insurance facility that they have with themselves. So preventive is very important, but just in case, just in case is a small statement. In many cases, we can't prevent. So then what do you do? So you make sure that there is curative health care. Also, you need curative health care for normal human activity. For example, delivery of a child. You understand that? So you need a hospital center and infrastructure of health. India has one, like our maternal mortality ratio is still very high. Maternal mortality ratio is number of women who die during delivery of a childbirth per 1 lakh children born. So in India, the number is still around 130. Now, if I compare it to even Sri Lanka or Bangladesh, the number is higher. In Sri Lanka, the number is 74. In Bangladesh, the number is 79. But in our country, we are still at 130, which is something we should get worried about. In India, even now, 2024, 14% deliveries take place with no medical professional present. And 27% deliveries take place with no doctor present. एक मेडिकल प्रोफेशनल रहेंगे लेकिन डॉक्टर नहीं है वो. जब मैं ये सब देखता हूं और तब मैटरनल मोर्टेलिटी रेशियो 130 देखता हूं तो मुझे लगता है भगवान हमारे ही देश में है कि कम से कम बाकी लोग बच जाते हैं. But this is something that we need to take care of, that unless we don't take care of these things, we will and the struggle is not only maternal mortality. Due to this kind of a lack of facility, the struggle is also child mortality or infant mortality, either of the two, as in children dying before reaching the age of 1 or children dying before reaching the age of 5. You understand that? The struggle is not only that. Even if these children survive, then the struggle is about lack of vaccination, lack of proper nutrition on birth. So then the children go stunted or the children go wasted. Their weight will be lesser or their height will be lesser. And that all creates problem for their capacity to work in future. You understand this? So this is something where we need to make sure that we have a good healthcare infrastructure to take care of things. And that is why I keep saying that prioritize your expenditure. कहाँ खर्चा ज़्यादा करना है, and also prioritize where will you look at to make sure that people have a good standard of living. That good drinking water, good sanitation, healthcare infrastructure, education infrastructure, that is what will create robust humans. और मैं फिर कल की बात रिपीट करूंगा, अगर humans strong हैं तो वो सिस्टम को स्ट्रांग बनाते जा सकते हैं. अगर ह्यूमंस वीक हैं, लेस एजुकेटेड हैं, लेस लिटरेट हैं, या फिर लेस हेल्दी हैं, या फिर लेस न्यूट्रिशनड हैं, तो फिर आप कितना भी सिस्टम में फिजिकल एट्रीब्यूट्स डालिए, द ह्यूमंस विल नॉट बी एबल टू यूटिलाइज व्हाट दे हैव with themselves. So, and that won't ever be permanent also, because the humans themselves will become a reason to restrict their own growth. So that is where India has been lagging behind, if you ask me, and one big factor for that is caste system, because rural areas we lag behind a lot, and then caste plays a big role at times over there. And another big area is lack of information network. देखिए जो भी primitive societies होती हैं, क्योंकि वो educated modern world के बारे में कम होते हैं, तो उनमें stubbornness बहुत होता है. अब देखेंगे डॉक्टर्स बार बार बोलते हैं बच्चे को काजल मत लगाइए, बट कोई एक दादी जी चाची जी आएंगी जो बच्चे के मुंह में काजल थोप के ही मानेंगे। डॉक्टर्स बोलते हैं दैट फर्स्ट 4 months इट हैज टू बी ओनली मदर्स मिल्क, बट समहाउ वी फील नहीं नहीं ऐसा कैसे पेट भर जाएगा इसका, कुछ तो और इसको ठुसा के ही मानूंगा मैं। मेरा बच्चा मोटा हाथी क्यों नहीं दिख रहा है, ठीक है। आप देखेंगे ये हमारे एज ओल्ड बिलीव्स हैं, that the child has to look very fat and then the mother gets all the compliments that you look after the child very well। तो मदर के भी मूड में रहता है कि अच्छा, ये गोलगप्पा क्यों नहीं दिख रहा भाई, ये नॉर्मल क्यों दिख रहा है। बट वो अगर आप चाइल्ड को उतना मोटा करते हैं, आप उसको खतरा देते हैं टाइप 2 डायबिटीज का, वो ओबीज हो गया, and childhood obesity leads to type 2 diabetes in your middle age is now a proven medical norm, कि जो बच्चे ओबीज होते हैं उनके चांसेस टू कैच टाइप 2 डायबिटीज व्हेन दे आर इन देयर मिडिल एज 45-50 इज वेरी हाई। तो सोचिए बेचारे को पता भी नहीं उसके साथ क्या हो रहा है, तो आपने उसको अपना ठुसा ठुसू के गोलगप्पा बना रखा है, आगे चलकर उसको वो फिट भी हो गया, खुद के ऊपर ध्यान भी रख लिया, तो भी सडनली उसको एक प्री डायबिटिक नजर आ रहा है और वो सोच रहा है क्यों हो रहा है, आई टेक केयर सो वेल ऑफ माई सेल्फ, बट दैट हैज बीन पुट इनटू हिज सिस्टम नाउ। So this is something about information that I was telling you. And the more healthcare system we develop, information networks can be better. What has the government done in India? We will discuss that when I'm teaching you the steps taken by government. But it can begin with, say, the Anganwadi system that we have, and it can reach out to the self-help groups all over. Along with that, there are primary healthcare centers established by government. There are community wellness centers established, and then the secondary healthcare and tertiary hospitals. But again, the larger question is about how are they functioning? Are we making them function well? Because unless we don't make them function well, I mean, again, the choice is simple. कोई भी अगर दिल्ली गवर्नमेंट ही बोले, जैसे क्योंकि हम लोग दिल्ली में हैं तो मैं उनकी बात कर रहा हूँ, क्योंकि इतनी बार बोले कि अब लोगों को लगने लगा है कि नहीं बात तो ठीक ही होगी कुछ, दैट हॉस्पिटल्स आर ऑल गुड, तो फिर कॉमन पीपल शुड बी चूजिंग गवर्नमेंट हॉस्पिटल्स बिकॉज दैट विल सेव देयर मनी। द पॉइंट इज दैट, and by common people I mean normal middle class people. Why would I go to a costly hospital if I know that I have a hospital which will save my money? But that litmus test they are still not passing. Couple of years back, Bhagwant Manji went ill. He developed food poisoning and all, and he admitted himself in Apollo Hospital. And he is the chief minister of the party which rules Delhi also. So at least he should have admitted himself in a Delhi government hospital to show the proof that look, we are doing great and I don't need a private hospital for myself. So this is the challenge we have. वैसे मेरे बेटे ने उस पर एक मजाक किया था, मैं डिनर टेबल पे हम लोग कुछ डिस्कस कर रहे थे तो यही कहा मैंने, तो उन्होंने कहा नहीं नहीं तुम उनके डिसरिस्पेक्ट कर रहे हो, वो बड़े नेता है। उन्होंने कहा कि ये वर्ल्ड क्लास हॉस्पिटल जो दिल्ली गवर्नमेंट के हैं ये मैं कॉमन लोगों के लिए छोड़ता हूँ, मैं छोटे मोटे अपोलो से काम चला लूंगा। So when they are sarcastic like this, they convince me they are my children, But anyways, the point that I'm driving home is that that litmus test is the real test. जिस दिन दिल्ली गवर्नमेंट या सेंट्रल गवर्नमेंट के ऑफिसर्स दिल्ली में रहते हुए अपने बच्चों को दिल्ली गवर्नमेंट स्कूल्स भेजने लग जाएंगे, इसका मतलब हो गया कि गवर्नमेंट स्कूल्स आर डूइंग वंडरफुल एंड दे आर एक्चुअली बीटिंग द प्राइवेट स्कूल। नहीं तो आप अखबार में जितना मर्जी छपवा लीजिए कि नहीं गवर्नमेंट स्कूल्स ने ऐसा कर दिया और हमने शानदार बना दिया है। अगर शानदार चीज होगी तो अमीर उसको छोड़ने वाले नहीं है, आप पक्का रख लीजिए। इतनी इकोनॉमिक्स पढ़ ली है मैंने, that anything which is wonderful, the rich will make a beeline for it. In case you need an example, All India Institute of Medical Sciences treatment. It is wonderful, the rich make a beeline there. अपना फोन बुक को यूज करते हैं, जरा मेरा बात बोल दो वहां, मेरा एडमिशन वहां करा दो। तो जो जगह अच्छी है अमीर छोड़ने वाले नहीं उसको। गुड कॉलेजेस फंडेड बाय द गवर्नमेंट, अच्छी जगह है अमीर उसको सबसे पहले पकड़ते हैं। तो आप अच्छा बनाएंगे, उसका एक टेस्ट होना शुरू हो जाता है कि अमीर पहुंचना शुरू होंगे वहां, क्या देखें मेरे लिए भी कुछ करो। वो नहीं है अच्छा, तभी अमीरों ने बोला कि छोड़ो अभी तुम चलाओ इस सबसे काम, मैं अपना अच्छा कर लेता हूं इधर कुछ और देखकर। सो दिस इज समथिंग वी नीड टू टेक केयर ऑफ। इफ वी डू दैट अगेन वी कैन क्योर हेल्थ बेटर and we can make things more permanent. So I'm making you write that. You change the paragraph and write, curative health care can be achieved. Curative health care can be achieved. No, this is in the same curative health care thing. Curative health, वो preventive health care के 3 points थे, अब curative health care की बात कर रहा हूँ। Curative health care can be achieved if illness can be treated if illness can be treated faster, illness can be treated faster and with stability, like you don't keep falling ill again and again. So with stability. This can be attained through, and you can take it as A, B, C, D again. So A, well spread provision of diagnostic centers, well spread provision of diagnostic centers. Second, establishing a network of primary healthcare, comma, secondary healthcare, and tertiary, T-E-R-T-I-A-R-Y. Tertiary healthcare is big hospitals and multi-speciality hospitals and so on. And tertiary healthcare. And then third, you write, assuring larger presence and better distribution, of trained medical professionals, So that, is another challenge that we have. Trained medical professionals. Sometimes I see the system taking a lot of pride in saying that only 7% people qualify the medical entrance examinations like NEET. Now, only 7% people qualify not because the others may not be that good, but because we don't have enough seats. So if we create enough training centers and enough healthcare training mechanism, we can do that. So that is for doctors. That आप ज़्यादा डॉक्टर प्रोड्यूस कर सकते हैं अगर better colleges establish करें, more training systems create करें, and it becomes worse on the upper end. Like you can still have MBBS seats, but for MD it becomes even more difficult. So that's another challenge. And the second is nursing staff in shortage at times because of the stagnant nature of the work. So people don't opt to be in nursing because they believe there is no career growth. So if you give them career growth by one mechanism or the other, then maybe we can attract more people into nursing. Like what the Chinese have done is that they say that if you have been into nursing for 12 years, then you will be allowed to write some examinations and you clear those examinations and we upgrade you to what they call barefoot doctors. So barefoot doctors are not people who will be allowed to do surgery and all, but they will be allowed to prescribe medicine and treat people and so on. अब देखो de facto India में ये वैसे भी होता है. So you will see that some people are compounders to the doctor. 7 साल 8 साल 10 साल शहर में रह के डॉक्टर के अंदर कंपाउंडर रहे, फिर वो अपने गांव जाकर डॉक्टर बन जाते हैं. गांव में सब लोग उनको डॉक्टर साहब बुला भी रहे हैं और वो लोगों को मेडिसिन प्रिस्क्राइब कर रहे हैं, कुछ वुंड वगैरह हो गया तो इलाज कर रहे हैं, स्टिचेस लगा रहे हैं. सो द पॉइंट आई एम ट्राइंग टू मेक इज that de facto is dangerous because there is nobody supervising it. So we don't know what kind of medicine is prescribed and what kind of things are done. But if we can actually develop some mechanism of treatment, then we can diversify things more. I'll tell you why I say that. WHO says that the ideal ratio doctor to population is 1:1000. That एक डॉक्टर पे 1000 अगर पॉपुलेशन है तो आप एक कम से कम इतना चाहिए आपके पॉपुलेशन में. In India, that ratio is 1:1300. So that is not a major challenge. Okay, 1000 and 1300 are not that big different from each other. But the challenge is dispersion of the doctors. So I'm quoting to you data from National Family Health Survey 2019, that in places like Delhi, the ratio is 1 is to 300. So you practically have a lot of doctors available and people get their treatment easily. But in states like Jharkhand, the ratio was found to be 1 is to 3700. So then it becomes a challenge finding a doctor for yourself if you become unwell. All right. And again, आप मान लीजिए आप में से कोई झारखंड से होंगे तो आप बोलेंगे अरे नहीं क्या बात करते हैं, मैंने तो देखा डॉक्टर बहुत सारे हैं. प्रॉब्लम ये है कि आपने रांची में देख लिया या लोहरदगा में देख लिया या दुमका में देख लिया, लेकिन जैसे आप अंदर इंटीरियर में जाएंगे तो वहां नहीं है, वो एब्सेंट है. बट ये प्रॉब्लम तमिलनाडु में नहीं है. This problem is not in Tamil Nadu that you will not find a doctor in the rural area. This problem is not in Kerala that you will not find a doctor in the rural area. You understand that? So that is what you need to map out. That okay, my doctors are there, but where are they and how are they spread? So again, if you have multiple numbers of people, they will be spread across better. Also remember, it's a function of civic amenities. Sometimes if the rural areas have bad civic amenities, people refrain from going there. They don't go. All right. So even if they are posted, they will not go there. That is why Dr. Kalam had said this around 21 years ago, that India should focus on Pura, providing urban amenities to rural areas. So go for Pura, and if India can do Pura, then even rural areas will attract, people better. एक नया कंसेप्ट आ रहा है, ये आपको बाद में सिखाऊंगा इंफ्रास्ट्रक्चर के वक्त, पर एक नया कंसेप्ट आ रहा है एक्स अर्बिया. एक्स अर्बिया है अर्बन एरिया बिटवीन रूरल एंड द बिगर अर्बन एरिया. ऑलराइट, कि नए टाउनशिप जैसा बना लीजिए या एग्जिस्टिंग टाउनशिप को अपग्रेड कर दीजिए. क्योंकि आप सोचिए, ऐसा थोड़ा ही है कि दिल्ली और गांव के बीच में और कोई टाउनशिप नहीं है, या पटना और गांव के बीच में कोई टाउनशिप नहीं है, या लखनऊ और गांव के बीच में कोई टाउनशिप नहीं है. बट क्या है, वो टाउनशिप्स भी इतने छोटे हैं कि गांव के लोगों को अकोमोडेट नहीं कर पाते, अंडर डेवलप्ड रह जाते हैं. सो एवरीबडी माइग्रेट्स टू द capital city or the cosmopolitan. So if we can develop that ex-urbia, and that ex-urbia can have its green space, and it can have planned schools, planned hospitals, production centers, then that can start accommodating a lot of people. And they will be the new tier 2, tier 3, tier 4 cities of India. So then that will reduce the burden of population on cosmopolitan system or metropolitan regions, and that will also increase efficiency of people, as they will not have to migrate too far off from their rural area, and they can still stay put, and that will improve environment, the healthcare facility. आप सोच के देखिए, अभी जो एयर हम लोग सांस ले रहे हैं दिल्ली में, जो भी मजबूरी है हमारी, लेकिन उस प्रोसेस में WHO has again found that on an average we are losing our lifespan by 7 years. So if somebody was expected to live till 80, now that person will live till 73. So कल मैं मजाक भी कर रहा था अपने घर में कि मैं 107 तक जीने वाला था, अब मैं 100 तक ही जी पाऊंगा. But these are reports that you see, and they are not very happy reports to see. Also, we still don't know the real impact air pollution kind of things will create on mental health care, the impact it is creating on our nerves. You understand that? So once we get to know कि अच्छा जब PM 2.5 आपने खूब सारा इनहेल किया तो आपके न्यूरल सिस्टम पे क्या असर डाल रहा है और आपके मेंटल ग्रोथ को कैसे अफेक्ट कर रहा है, all that is again the unknown at the moment, which is again preventive healthcare and curative healthcare we need to take care of. So this is about ex-urbia or Pura. If we can focus on those things, then I think maybe we can upgrade ourselves much better. Okay, so I take you on this further. One more point you write, D, and just to conclude on my previous point, therefore we need more trained medical professionals. एक और दिक्कत है trained medical professionals की, we lose a lot of them to migration. बाहर चले जाते हैं. In fact, I had an experience in Massachusetts when I was there, that doing my PhD, that every 6th or 7th doctor will be an Indian. So when you went to their healthcare centers, you would feel as if you are in a mini India, that almost everybody would be, every 5th, 6th person will be an Indian, and otherwise maybe a Chinese. Chinese doctors bhi bahut the wahan, but Indians would also be there quite a bit. And wherever I went, because Massachusetts is not very far off from Boston, so if one would go to Boston, even there one would see a lot of Indian healthcare specialists. So this is where we are losing a lot of our doctors. And another place we lose some of our doctors is when they choose to join services other than medicine. Say, for example, UPSC. So they qualify civil services, then they are not a doctor anymore, because then they are bureaucrats. Another place where we lose our doctors, and this is happening now in India quite on some scale, is when they go into management of hospitals. So they are actually trained medical professionals and they know their medicine well, but then they are not treating people. They are managing hospitals which are super specialty centers and they are paid in crores. So that becomes a very lucrative option, that rather than treating and doing things, let's go into this management of hospital thing. So all that is also a challenge we need to take care of when it comes to availability of medical professionals. आप कहें सर अब इसमें से किसी को आप रोक नहीं सकते, अब ये नहीं कह सकते लोगों को जाओ मत, लेकिन आप इंडिया में रहना ज़्यादा अट्रैक्टिव बना सकते हैं. The point is that if we can make it more attractive to stay in India, how do you make it more attractive to stay in India? Better career growth, permission to do world-class research, permission to interact with global healthcare system. So in that case, your good brains don't leave you. They stay with you. Similarly, we can't stop people from joining civil services. So in that case, have an assignment where more doctors can be created. Or similarly, we can't stop people from joining management in the hospital. So again, more numbers can be an answer to that, and less stringency in selection, and then better training centers. All that is what we need to develop across. Of course, it cannot happen in 2 years or 1 year, and therefore the beginning has to be done as soon as possible. जितनी जल्दी करें, उतना ज़्यादा बढ़िया होगा. All right, then you take the fourth point, provision of medical stores, to sell cheap generic drugs, GENERIC. जेनेरिक ड्रग्स होते हैं जो ब्रांडेड ड्रग्स हैं, वही सॉल्ट होगा लेकिन वो अनब्रांडेड होगा. जैसे मान लीजिए एक ब्रांडेड ड्रग हो गया डोलो, तो लोग जानते थे ठीक है पैरासिटामोल इज डोलो 650 and people take that as they go on wells. That's a branded thing. But somebody can sell non-branded paracetamol and at a much cheaper rate than say a dolo. And that can apply on many medicines, even life-saving medicines. तो आप देखेंगे एक सरकार ने स्कीम शुरू किया है करीब 6-7 साल से, 6 साल से, उसे कहते हैं प्रधानमंत्री जन औषधि योजना. And there are प्रधानमंत्री जन औषधि केंद्र, various places, and they are selling generic drugs. So they will be selling the drugs at something at 50% of the price of the branded drug, or 70% lesser than the price of branded drug. Helps people. All right. And then put a note below that and write, ये जितना भी आपने लिखा preventive, curative, उसके नीचे एक note put करिए और लिख लीजिए. You write, healthcare planning should include planning for mental health security, both by prevention and treatment. Because that is again something which we have ignored a lot. एक चीज जो मेरी जनरेशन नहीं समझ पाती और बहुत कैलसली बोलती है कि अरे हम लोगों को तो डिप्रेशन नहीं होता था, तुम्हें इतना कैसे हो जाता है. हमें डायग्नोज नहीं होता था. प्रॉब्लम वाज दैट, हम जानते नहीं थे. ऐसा नहीं था कि आज से 100 साल पहले किसी को या 500 साल पहले किसी को ट्यूबरक्यूलोसिस नहीं होता होगा. पता नहीं चलता था कि उनको ट्यूबरक्यूलोसिस था. बाद में हिस्टोरियंस ने जब चेक किया कि किस रीजन से मरे, तब कंक्लूड किया टीबी हुआ होगा इनको. पर उस समय के लोगों को पता ही नहीं चला क्योंकि डायग्नोसिस नहीं थी. सो दैट इज वन. सेकेंड, विदाउट एनी डाउट, ड्यू टू द चेंजिंग ग्लोबल स्ट्रक्चर ऑफ लास्ट 100 years, the generations that are coming in future are taking huge mental burden. Without any doubt. It goes without saying. आप सोच के देखिए, एक अभी बोर्ड रिजल्ट्स आए ना, जैसे जब हमारे बोर्ड रिजल्ट आते थे, तो ठीक है, हम पे भी प्रेशर होता था, बट हम पे प्रेशर होता था परफॉर्म कैसा करेंगे, और कौन जानेंगे, तो कौन जान सकते हैं, घर के लोग और आस पड़ोस के दो चार लोग, और बहुत से बहुत में भी कुछ एक दो रिलेटिव्स ने फोन कर दिया जिन्होंने कभी नहीं किया था बट उसी दिन किए जानने को कि कैसा किया बच्चे ने। आपके जनरेशन के साथ तो बड़ा गलत हो रहा है, सब कुछ व्हाट्सएप और इंस्टाग्राम और फेसबुक पे है, तो आप उस प्रेशर में जीते हैं कि भाई मेरा रिजल्ट तो गली नुक्कड़ पे लगेगा, और जो पेरेंट्स हैं कभी कभी वो भी उसी प्रेशर को जीते हैं। बिकॉज आई कैन नेवर अंडरस्टैंड व्हाई अ फादर और अ मदर हैज टू से दैट score well, otherwise to their child, that is score well, otherwise what will I tell the world? I'll tell nothing to the world. My child and my house, what's the world got to do with it? बट मैं बहुत बार देखता हूँ ये डांटते हुए, तुम अगर अच्छा नहीं करोगे मैं क्या जवाब दूंगा लोगों को, मैं क्यों जवाब दूंगा लोगों को, भाई मेरा खर्चा थोड़ी चला रहे हैं। मैंने 2-3 साल पहले मेरे एल्डर सन 12th कर रहे थे, उनको यही कहा था, वो थोड़ा प्रेशर में दिख रहे थे। एक दिन मैंने कहा क्या हो गया, दुखी क्यों है, कहते डर लग रहा है नंबर नहीं आए तो। मैंने कहा भाई इस बात की वजह से अगर तू मेरा बेटा नहीं रहेगा और मैं तुम्हारा पापा नहीं रहूंगा तब तो बता, अगर वो रहेगा तो फिर नंबर आए ना आए क्या ही फर्क पड़ जाता है, इट डजंट मैटर। बट देन आई स्टिल सॉ हिम वरिड, ऐसे दिक्कत क्या है तुझे, बोलता नहीं बुरा लगेगा नंबर नहीं आएंगे, लोग क्या बोलेंगे। ऐसे लोग क्या बोलेंगे, हम लोगों को कह देंगे तेरे 99% नंबर है, बात खत्म हो गई। अब बाई चांस समबडी एंटर सेइंग नो आई हैव हर्ड, व्हाट हैव यू हर्ड, पापा मैं हूं, जाओ यहां से, कहां घुस रहे हो मेरे घर में। नंबर इसलिए थोड़ी जरूरी है क्योंकि आप अच्छे स्टूडेंट हो या बुरे स्टूडेंट हो, अगर आपके अच्छे नंबर आ गए, अच्छा परफॉर्म कर लिया, इट गिव्स यू अ वैलिडेशन कि अच्छा जो आपका प्रोसेस था, जो आपके मेथड्स थे वो गलत नहीं थे। दैट इज द ओनली रेलेवेंस ऑफ मार्क्स इन दिस वर्ल्ड, that they give you a validation that okay my processes have been okay, my processes have not been right. In case god forbid somebody doesn't get good marks, okay check the process, that am I doing any flaw in my process, and if there is no flaw in the process stick to that, maybe you were just plain unlucky, and if there is a flaw in the process pick it up, solve it, period. ये सिंपल सी बात है। अभी मेरा ब्लड टेस्ट हो गया मान लो, और 1 मिनट के लिए एक डिजीज आए मेरे ब्लड में, तो हम ये थोड़ी कहते हैं हे भगवान क्या कर दिया तुमने, अब मैं लोगों को क्या बताऊंगा, पड़ोस वाले को कैसे बोलूंगा मेरा पापा प्री डायबिटिक है, ये तो नहीं बोल सकते, या वो बोलते भी नहीं है, उल्टा उसका इलाज करते हैं। तो नंबर वही ब्लड टेस्ट की तरह है, वो बताते हैं कि आप कहां पर हैं, अपना इलाज कर लीजिए ठीक हो जाएगा। सो इट्स जस्ट दैट। 10th स्टैंडर्ड में हो सकता है किसी को नहीं मन लगता है, उनको इंजीनियरिंग करने का मन है, उनका इंग्लिश में नहीं मन लगता, उनके इंग्लिश में 70 आ गए, उसकी वजह से परसेंटेज 85% हो गया, तो खराब स्टूडेंट थोड़े ही है। जो उनको करना है लाइफ में, उसके लिए तो मैथ्स और साइंस में अगर उनके 198 आ रहे हैं वो फिट है बिल्कुल, लेट देम डू व्हाट दे वांट टू डू। द पॉइंट आई एम ड्राइविंग होम इज दैट, बट दैट इज अगेन अ चैलेंज टू मेंटल वेल-बीइंग, because there is unnecessary pressure we take for that, you know. Along with that, remember a modern world puts more pressure of nuclear families, so that means the bulwark of a joint family where a grandparent who would have some good wisdom is almost absent at times, you know, because sometimes they would have that wisdom part. I grew up with my grandparents, I know it very well, they would calm you down, तो आप pacified ही रहते हैं, आपको गुस्सा कम आने लगता है क्योंकि आप देखते हैं अच्छा इनको नहीं आता है, उन्हीं के साथ बड़े हो रहे हैं, आपकी कुछ हरकतों पे भी वो कुछ नहीं कहते, समझा देते हैं बस। So when you do it like that, then the neural system, the mental health care system can be done better. School counseling methods identify children who are either very quiet or who are hyperactive, and then that can be treated by normal counseling, and they don't have to be told that they are in a counseling. The counselor can talk to them as their teacher and solve the issue. So if we identify those, we will have less issues of depression, less suicides and challenges. जैसे आजकल और हम गलत डायग्नोसिस करते हैं हमेशा, जैसे एक आजकल मैं अखबार में पढ़ता हूँ बच्चे सुसाइड कर रहे हैं, ट्यूशन सेंटर्स का बहुत प्रेशर है। ट्यूशन के टीचर को इतना सीरियसली लेता कौन है भाई, कि उनके बोलने से कोई सुसाइड कर लेगा? Who takes them that seriously? And why would anyone take them that seriously? Why should I take anybody that seriously who is toxic? Think about it. But that last part is the training. ये last part सब लोग नहीं जानते कि some people are toxic, I don't have to take them seriously. It's their problem. It's not mine. So once we train people in the mental health care system again, we can save a lot of lives. That's one. But not only that, we can also make sure that we don't lose productivity in the economy. अब जैसे तुम लोग पढ़ते हो, 8 दिन पढ़े, 7 दिन पढ़े, एक दिन मन करेगा कुछ ना पढ़े. तो अगर तुम ये कॉन्शियस हो कि हाँ ये मेरा माइंड बोल रहा है मुझे that I don't want to study, तो तुम कॉन्शियसली प्लान करोगे when should you have a break. और ब्रेक के बाद आप इमीडिएटली वापस 8 आवर्स पे नहीं आ सकते. सो द मोमेंटम विल बी जनरेटेड ओवर अ पीरियड ऑफ टाइम. तो पहले आप 4 घंटे पढ़ लेंगे, अगले दिन 5 घंटे, 8 घंटे, फिर एक दिन 10 घंटे, फिर वापस वो आ जाएगा एक दिन ब्रेक पे. दिस इज नॉर्मल. बट इमेजिन when our mind doesn't realize it, we feel guilty at times, we feel frustrated, we are upset within, we are angry on others. All that is happening because I am willing to study. मेरा माइंड कह रहा नहीं पढ़ना बहुत जरूरी है, नहीं तो तुम आईएएस नहीं बनोगे, दिन रात पढ़ो. और कोई सज्जन लोग यूट्यूब पे आके बोल भी देते हैं मैं तो 13 घंटे पढ़ता था. तो लगता है कि यार बनने के लिए तो यही पढ़ना पड़ेगा. और बॉडी और माइंड साथ में कह रहा है कि नहीं, आई एम रिपल्सिव, आई डोंट वांट टू डू इट. So we conducted a study at Massachusetts. It was an experiment where we made people sit in a particular manner. They were given a problem to solve, and we made them sit with lighting done in a manner that their face was forced to smile. You know, lighting कर दी थी इस तरह की हमने कि आप ऐसे करके ही बैठ सकते हैं. वो लाइट आपको ऐसा करवा रहा था, आप स्माइल कर नहीं रहे थे. और दूसरे लोगों को बिठाया इस तरह से that their faces had to droop, कि वो दुखी होकर बैठे हुए थे. उनको लाइट ऐसे करवा रहा था, वो creased brows and folded hands and eyes and so on. And you know what we found very astonishingly, and this experiment was conducted over 500 people each, and we found that the problem solving efficiency of people who were forced to smile because of the lighting was 37% higher than those who were drooping. So even if you trick your brain into being happy, कि आप नॉर्मली स्माइल कर दीजिए, आपके ब्रेन को लगेगा अच्छा मैं किसी कारण से हैप्पी हूं, that will improve your efficiency, was what we concluded. And there were many more things in that experiment, but I'm not here to tell you that. But I'm just sharing with you a part that I've been a part of. I'm in an experiment, and this is something that applies on the human brain. That sometimes we can trick the brain into believing it's all fine, and similarly sometimes the brain can trick you into believing all is wrong. तो वो चीज तो मेंटल ट्रेनिंग है ना, कि अगर आप लोगों को ट्रेन करते जाएं वो ठीक हो जाएंगे. तो हमेशा दिमाग में रखोगे, रीड करोगे, आपको पढ़ाया भी जाएगा एथिक्स एंड ऑल में. बट ऑल ऑफ अस हैव आवर इडियोसिंक्रेसीज, ऑल ऑफ अस. हम में से कोई ऐसा नहीं है जिसमें इडियोसिंक्रेसी नहीं है. किसी को आप देखेंगे वो शर्ट के दाहिने तरफ ही हाथ पहले डालेंगे. ऐसे कुछ हमारे सबके बिलीफ सिस्टम्स होते हैं, और वो हम अपसेट हो जाते हैं अगर वो नहीं होता उस दिन उस तरह से. दिस इज नॉर्मल इडियोसिंक्रेसी. It's just that we identify our idiosyncrasy and live with it, rather than leaving it unidentified and struggling, not even realizing what's happening to me. आपको एक आखिरी एग्जाम्पल देता हूं, आप सोच के देखिएगा. रेबेलियन कहां से आता है हम में, आप सोचिए. एक नॉर्मल रेबेल है हम लोग. किसी ने कुछ बोल के टीचर का मजाक उड़ाया तो वो हीरो हो जाता है. अब नॉर्मल देखिएगा, सब लोग क्या सुनाया आज टीचर का मजाक. नॉर्मल है ये, और मैं किसी को दोष नहीं दे रहा हूं, ये हम में नॉर्मल होता है. हम लोग भी 12th में थे, मुझे याद है, जो जब बड़ा हो गया, लेकिन जब तक हम छोटे होते हैं यहां से, वो रेबल हमारे अंदर का जा नहीं रहा होता. अभी भी कोई सरकार के अगेंस्ट कुछ लिखते हैं, अब देखिएगा आप ऐसे मानेंगे उसे, समथिंग अगेंस्ट एडमिनिस्ट्रेशन. और यही योजना मैगजीन पढ़ोगे, फॉर द गवर्नमेंट कुछ लिखा होगा, ऐसा होता थोड़ी सिर्फ लिख रहे हैं ये लोग. So why that anti-administration, anti-authority thing? Because of the patriarchal system in which we grow up, with the thumb rule applied on us, जहाँ पहले टीचर धुलाई करते हैं, कभी पेरेंट्स धुलाई करते हैं, कोई हमसे बचपन में नहीं पूछ रहा तुम्हारी क्या इच्छा है. तो हम ग्रो ही करते हैं रेजिस्ट करते हुए अथॉरिटी को. वो हमारे साइकी का पार्ट बन जाता है. उसके बाद हम रियलाइज भी नहीं करते that it's a part of my psyche now. I am resisting authority. I am not liking it. So anybody authoritarian, I dislike. Because it all goes back, class 1, class 2, teachers आपको डांट रहे हैं, तुम्हारा यूनिफॉर्म सही क्यों नहीं है, तुमने बैच क्यों नहीं लगाया, तुमने शूज पॉलिश क्यों नहीं किए. अब वो क्लास 1, 2 का बच्चा है. For that fellow even Spider-Man exists. अगर उसने बैच नहीं पहना या शूज नहीं पॉलिश किया, talk to the parents and talk properly to the child. वो हम लोग करते नहीं, डांटते हैं, इंसल्ट करते हैं. तो फर्स्ट सेकंड थर्ड फोर्थ आप देखेंगे एज किड्स ऑल ऑफ अस हैव एक्सपीरियंस्ड इट, वी आर worried going to the school. But when once we become a little more mature and we are in adolescence, 14 years, 15 years, 9th standard, 10th standard, 11th standard, 12th standard, the school is worried we are coming. Because now we start giving it back. टाई ऐसे आधी रहेगी, बैच ऐसा लटकता रहेगा, हमारे साइज ये हो गया, टीचर यही रह गए, अब हम उनको देखते हैं गुड मॉर्निंग सर. ये इसलिए नहीं क्योंकि हम बदतमीज लोग हैं. The mind has it in itself somewhere. These guys didn't treat me well. And then these guys becomes a common noun and it becomes everybody in authority. नहीं तो सोचिए, और आप तो जरूर सोचिए क्योंकि आप इंडिया को एडमिनिस्टर करने की सोच रहे हैं, हम कितने खतरनाक लोग हैं एडमिनिस्टर करने को, कि आपको हमें समझाना पड़ेगा कि हेलमेट लगाने से तुम्हारी मुंडी बचेगी, नहीं तो हम नहीं लगाएंगे. हम अपनी एल्बो को बचाते हैं. हेलमेट यहां होता है, बस आप मेरे सामने कोई पुलिस वाला खड़ा करिए, तब मैं पूरी कला के साथ उसको अपनी मुंडी पे लेकर आऊंगा. सोचिए, I have to be trained that it's my head which will be saved by the helmet, and you have to fine me for that. So administering that country is not all that easy. But where does it come from? Rebellion about authority from childhood as a psychological gesture. It comes straight away from there. So this is what we need to kind of टेक केयर. एक एग्जाम्पल दे रहा था तुम्हें कि अगर हम बचपन से बच्चों के साथ अच्छे हो जाए तो हम वंडरफुल सिटीजन्स क्रिएट कर लेंगे who will not be defined in nature. डिफाइंस नहीं तो हमारा नेचर बन जाता है जो हमें ही नुकसान करता है, पर वो नेचर बन गया है. अब कॉलेज डेज को याद कीजिए, स्कूल डेज को, किसी ने रूल मान लिया तो बाकी लोग मजाक उड़ाते थे, तू डर गया. और वो भी ये नहीं कहता था कि मैं सिविलाइज्ड हूं इसलिए रूल मान रहा हूं, नहीं डरा नहीं, बस आज थोड़ा देख लिया. So you're making somebody feel guilty for following rules. So understand that that's not a system you would like to create for long-term development of any economy or social mechanism. Okay, just take care of these things, and if we are kind to our next generation, the next generation is then kinder as they grow up to us. So it's always like that. Okay, now I take you further. Now you give a heading. You write. So these are the methods of intra-generational equity. I told you physical infrastructure development, civic amenities, financial inclusion, education, healthcare. All right. Now you first take a question, not a heading actually. We will discuss that and then we will go further. You write, critically analyze the role of GDP as a measure of welfare. Welfare means development. All right, that is a measure of welfare, what development you have achieved. So the question is, how good or how bad is GDP in measuring welfare? कि जब आप जीडीपी को यूज करके वेलफेयर को कोनोट करते हैं तो उसमें क्या फायदा है, क्या नुकसान है, ये हमें डिस्कस करना है, एंड देन द सॉल्यूशन हैज टू बी द कंक्लूजन ऑफ इट. So I'm making you write this answer actually so that I can teach you how you can approach an answer. So to begin with, you can write an introduction. You write, higher GDP implies more resources in the economy, which leads to using it as a measure of welfare. Remember, even if it is a 10-mark question, even 150 word, start your question with something like a 10 to 15 word or 18 word introduction. All right, begin with that. And then come to the basic body of the part. Now what do we write here? We will first write the benefits that GDP creates with respect to welfare, the benefits, the good part of it, and then the challenges that it creates, and then the solution to it. Now, why do I write benefits first and challenges later? Because when I will write challenges later, then the answer will flow better if after that I suggest the solutions. You understand that? क्योंकि challenges के बाद solution आना चाहिए. तो आप benefit वाला part पहले लिख लें, फिर challenges और फिर concluding by suggesting what should be done. Alright, so always start practicing your questions by determining the structure of it in the mind. Content is number one. If your content is good, you are marked well. Number two is how you are structuring your answer. What should come first, what should come later. And number three is what are your expressions? How good you wrote? Did you write very casually or did you write formally? The writing always has to be formal. जैसे basically it means, ये casual writing है. Basically क्या होता है? क्यों लिखोगे उसको अपने आंसर में? एक वर्ड भी खा रहा है तुम्हारा. तो ये casual writing है. So it can be said. क्यों so क्यों? ऐसे तुम बोलते हो, लेकिन ऐसे लिखते नहीं हैं. So we have to be careful how we are writing. That is expression. Also, expression is about what kind of choice of word you are making, but that's less important. You don't have to write very chaste English. You don't have to write, everything in a very flowery language. You just have to write correct in an easy to understand language, but the structuring and the expressions have to be proper. So let's see this. Now, you write within that. Change the paragraph and write, GDP promotes welfare provide. I'm making you write it. Yeah, I'm making you write it. Yeah, you can write it like that. No problem. GDP promotes welfare because and you write below that again, and you can write them as A, B, C, D, 1, 2, 3, 4 bullet points. It just doesn't matter. They don't deduct your points for all this. So you write first point below that. It increases output which makes more goods and services available. It increases output which makes more goods and services available. So automatically, if there are more goods and services available, you are better off. Second, then you write below that, it can increase employment generation. It can increase employment generation. Third point, it leads to better technology through R&D. R&D is research and development. Through R&D, research and development. Then you write next, fourth point. It can create higher tax revenue which can be used for development. Change the paragraph. However, GDP growth may not be sufficient for welfare. GDP growth may not be sufficient for welfare because, and again you write 1, 2, 3, 4. So first, population growth can be high. Population growth can be high, which restricts per capita income. Population growth may be high, which restricts per capita income. You understand that? That if my GDP is rising fast, but my population is growing fast also, then my capacity to distribute remains limited. In fact, that's exactly what happened with India in the first decade after independence. We were one of the 3 fastest growing economies in the world between 1951 to 1961. All right, we were growing at around 4% per annum. But then our population was also growing at around 2.5% per annum, approximately. So the leftover part became very small. So if the population growth is high, then the per capita is not high, and that can compromise your possibility of welfare. Second point, then you write 2, high pollution does not reduce GDP. But reduces welfare. Now, just to give you a correcting note, high pollution does reduce GDP, but over a long period of time. So when you have high pollution or you have environmental degradation, then maybe over 10 years you will see that your production capacity is going down, or maybe 15 years. But immediately it makes no impact. All right, immediately it seems as if everything is growing and GDP looks high, but then people are getting unwell gradually, natural resources are getting depleted, but that doesn't get accounted for. There is nothing that accounts for depletion of natural resource. It only accounts for usage and production, so GDP looks to be higher. I hope I'm reaching you on this. Third point you write, it can increase, it here is GDP, it can increase with rising inequality, which is against welfare. Another point you write next. If high GDP is accompanied by high incidence of poverty, then it reduces welfare. Some examples I can give you. Take countries like Brazil, or countries like Argentina, countries like Peru, countries like Bolivia. These are all countries comparatively richer than India. In fact, Brazil has a per capita income of $13,000. Argentina has a per capita income of $12,000. Our per capita income is not even $3,000. But the incidence of poverty in these countries is much higher than what is seen in our country. And that is mainly because of government not taking active policies to remove poverty, or growth mainly concentrated among the rich. So if you are rich, then you are very rich, understand it like that. But then if you are poor, you become very poor. I'll quickly share with you one thing that had happened. We had been to Rio de Janeiro, that is Brazil, for a study trip. तो वहाँ जब गए थे तो वहाँ जो पुलिस पीपल थे, हम 4 लोग थे जो गए थे वहाँ पढ़ने मतलब कि एक स्टडी ट्रिप के लिए। तो जो पुलिस थे वो हमें इंस्ट्रक्शन दे दिए दैट X, Y, Z, A, B, C regions are there of the city where you don't have to go, and if you go that side, then we are not responsible for your well-being. You know, they came and gave us this briefing कि ये जगह आप नहीं जाएंगे और आप जाते हैं तो आपका फिर जो होगा वो आप जानिए, हम हेल्प नहीं कर सकते. Because they were ghettos, slum areas, big slums, and people could kill you for a Nike. You know, so that used to be the law and order thing. Another thing that I've read about Brazil, and that's again a disturbing factor, is that in Rio de Janeiro, due to bad infrastructure and urban congestion, the traffic has become so slow that the CEOs of major companies do not drive to meet each other. Every company has a helipad on its top and they fly to meet each other within the same city. वो हेलीकॉप्टर से जाते हैं एक दूसरे के पास और मिलते हैं. ये अर्बन इंफ्रास्ट्रक्चर के कंजेशन का एक बेसिक एग्जाम्पल है जो वहाँ हो रहा है. आप सोचिए क्या वेस्टेज है. यू आर वेस्टिंग एयर टर्बाइन फ्यूल टू मूव इन द सेम सिटी, बट द एवरेज ट्रैफिक स्पीड इज 3 to 4 किलोमीटर्स पर आवर. तो अगर आपको किसी से मिलना है जो 20 किलोमीटर्स पे है तो आप 5 hours स्टक हो सकते हैं on a busy day. So that is why the CEOs, they say, okay, let's fly and go from one place. So this is not something that you would imagine in a rich country, but we have rich countries comparatively which are experiencing it. All right, and that is the reason why Brazil or Argentina, which were touted to be the next big power, are stuck up in where they are stuck up. Understand that also. 1880s, जैसे आजकल बात होती है ना that this century can be China's century or India's century. So in 1890s, 1880s, there used to be a talk that the next century will be either United States century or Brazil or Argentina's century. They were the top 2-3 countries of the world among the emerging ones. But now 100 years later, we all know what happened. So the USA did very well for itself, but Brazil and Argentina just went down the hill. And one big reason, I repeat again, is their inequality playing a big role in bringing them down. All right. Then you write the next point. You write, GDP does not consider transfer payments which contribute to welfare and improve it. So you know how we are planning our structure now. I'm just teaching you. 15 odd words introduction, 40-45 words on reasons why GDP is a decent measure of welfare, and 55 odd words, 60 words on why it is not a measure of welfare. अभी तो ये शुरुआत के दिन है, but gradually you will know how many points I have in my mind. So the structuring should begin like that. That okay, I have 4 points on why it is a good measure, so maybe 10, 12 words each, and average, some can have 15, some can have 5. And similarly, I have 5 points on why it is not a good measure of welfare, and I can again have a 10 to 15 word average. So 50 words for benefit, 60 words for why it is not a good measure, 15-18 words of introduction, and last 15-20 words of conclusion suggesting the solution to it. So then you live within 150 words, you are not writing anything extra, you are not unnecessarily peddling words, but you are precise and clear to your examiner that look, this is how it is. So what can be the conclusion? We know that GDP is a necessary condition for inclusion, but not sufficient. So what is sufficient? If we can also include measures like green GDP. Green GDP is when we talk about GDP measurement after adjusting for loss of natural resource. Then we say that is green GDP. आपको पढ़ाई जाएंगी ये बातें, तभी मैं उधर नहीं जा रहा हूँ, but आप समझ रहे हैं मेरी बात कि अगर मैं ये चेक करूँ कि अच्छा GDP growth is this much, but how much is the loss due to extraction of minerals, how much is the loss due to environmental degradation, you understand that? So if I can accommodate all that, then the GDP I get is my green GDP. Before I make you write the conclusion, I'm explaining the last point to you. When I use the word transfer payment means all those payments which are made without any purchase of goods and service or without any quid pro quo. बदले में कुछ नहीं लिया, but payment कर दिए. जैसे आप किसी beggar को ₹10 दिए, तो आप उसको ये थोड़ी कहते हो चलो भाई ₹10 दिया, जरा हाथ दबा दो मेरा. There is no quid pro quo. You understand that? You pay the money and that is charity. Similarly, if you give donation to any institution, there is no quid pro quo. Similarly, any scholarship that a student receives, or a subsidy that a government gives, or a tax that people pay. So in that case, we say all such payments are transfer payments. Now see, a subsidy or a charity or a donation can improve welfare, but GDP doesn't add that. So if GDP is not counting these, it is somewhere underestimating the welfare that we are looking for. Do I believe we get that? Okay. So you write now below that, this is the conclusion. GDP is a necessary, GDP is a necessary but not sufficient GDP is a necessary but not sufficient condition for welfare, full stop. Therefore, it should be accompanied by green GDP, comma, HDI is Human Development Index, HDI, comma, MDPI is Multi-Dimensional Poverty Index. Alright, that is MDPI, Multi-Dimensional Poverty Index. So MDPI, etc. to get more holistic information on growth. All right, more holistic information on growth. So this is about the idea of GDP as a measure of welfare. That is how we take it, GDP as a measure of welfare. Okay, you read through this question later on, I mean the answer that I made you write, think over it, that okay, what was the structuring, how did we create this? That will help you in writing more answers. मैं आपको एक question दे रहा हूँ, you write this question, then I can take your question. आप इसको ट्राई करेंगे और आप मुझे दिखा भी सकते हैं whatever you write. So you write, analyze the challenges to intergenerational equity and how it can be solved by policy making. Try putting it in 150 words as a 10 marker. All right, try this question in 150 words. Yes, yes. When you produce with a poor technology, you will still increase your GDP, but you will pollute the country a lot. You understand that? All these people who are driving all these rural transport vehicles and automobile which are not serviced well are still earning money and contributing to GDP. But then they are creating pollution also along with it, and that's going to harm welfare. All right? Okay. Talk inclusive growth. So inclusive growth will always have growth in it. All right, that is the aspect. You can't have inclusion without growth. Yeah? All right. Now you give a heading, you write, steps taken by government steps taken by government to promote inclusive growth. Steps taken by government to promote inclusive growth. You can send me the answer, Prabh Simran, on the Telegram ID that I have given you. I will be willing to see through that. It is at the rate VJ1976. Okay, I have a question. I'm quickly answering it. Good morning, Subhasis. The question is, what is critical analysis? So, critical analysis always means that you have to do both sides of the story. All right. Whenever they say critically analyze, it always implies that talk about the benefits and talk about the challenges. Critical doesn't mean criticism. Do not confuse because of bad English. All right. Critical का मतलब कभी भी critical word का मतलब criticism होता ही नहीं वैसे भी. Critical का मतलब होता है जो deeply analyze करे चीजों को. All right. जब आप कहते हैं मैं critically सोच रहा हूँ इस बारे में, critical critique उसको कहते ही नहीं है जो सिर्फ बुराइयां निकाले. That's not a critique. That's an unnecessary understanding. A critique is a thing or a person who would look into all aspects and then suggest to you what is right, what is wrong, and what should be done. You understand that? So critical analysis will always be that. Right now I'm not doing it. Between your prelims and mains I conduct such classes because then only you will need it. I will be teaching you differences between terms like elaborate, describe, discuss, explain, critically analyze, only analyze, and so on. जब वो ऐसे लिख के देते हैं आपको तो क्या मीन करते हैं ये मैं सिखाता हूँ, लेकिन अभी पहले आप ये baby steps ले लें. You understand the basic things, and then maybe I can take things further and start teaching you about semantics as to what one word means or the other word means, and we can do things there. But right now just focus on content and structure. अभी तुम्हारा दिमाग उस पे रहना चाहिए that what should be my content and what should be my structure. Then gradually we will learn expressions. That okay, how to make expressions better. All right. So आप जो क्वेश्चन मैंने आपको दिया है आपके पास नोट्स में इसका आंसर है, तो आप ये भी कोशिश मत करिए कि नहीं अब मैं कुछ जबरदस्त ढूंढ के लाता हूँ किसी और दुनिया से. मैं बस ये देखना चाहता हूँ कि जो तुम जानते हो उसे ही कैसे प्रेजेंट करते हो. How do you present what you know? So we'll learn like that, and every time we do something on mains, I will give you a couple of questions, you write it, show it to me, and we'll get to see how you are doing in that. All right? Okay, let's see this then. So when we talk about steps taken by government, एक शुरू करते हैं पहले PM Janman Yojana. I'm first making you write some of the recent schemes, and then we will go to others also. So this Janman stands for Janjati Adivasi Nyay Mahabhiyan. ये है जनमन. All right. मुझे कभी कभी आप लोगों के लिए बहुत तकलीफ भी होती है कि सरकार इतने सारे स्कीम अनाउंस करके सिलेबस बढ़ा देती है और इम्प्लीमेंट करती नहीं है स्कीम को. All right. So let's see this. You write the scheme was introduced. The scheme was introduced on 15th November 2023. Why 15th November? It is Janjati, yes. So Janjati Gaurav Divas, isn't it? And why do they call it Janjati Gaurav Divas? Correct, absolutely. Birthday of Bhagwan Birsa Munda, as they call it, absolutely. Fair enough. So 15th November 2023, Janjati Gaurav Divas, keep that in mind. In the same thing, then you write The scheme will focus on 5 areas of development, 5 areas of development in tribal regions. In tribal regions, they are, and you can take them as 1, 2, 3, 4. So you write 1, testing till saturation, testing till saturation. Saturation means covering 100% population. All right, जब सारे population cover हो जाए तो हम कहते हैं that is saturation. So testing till saturation for sickle cell anemia. Again, sickle cell anemia is a common disease in the tribal belt. All right, so for sickle cell anemia, and immunization, IMMUNISATION, immunization for tuberculosis, you can write TB, immunization for tuberculosis or TB, full stop. In the same point you write maternal support scheme and Indradhanush scheme. Maternal support scheme. Maternal support scheme is that government provides 6,000 rupees over 6 months, 1,000 rupees each for 6 months to newly born child and the mother for nutrition purposes. All right, ये इंडिया में एक इसको अलग अलग नाम से वो यूज करते हैं. कुछ जगहों पे कहा जाता है प्रधानमंत्री मातृ सहयोग योजना, कुछ जगह कहते हैं प्रधानमंत्री मातृ वंदना योजना. You understand that? So there are different names for it, but the scheme remains same, that if there is a newborn child, then the mother and the child will receive 1,000 rupees for first 6 months of the childbirth. So that is maternal care scheme. And in the same thing, you put a comma and write, you wrote Indradhanush scheme, maternal care scheme and Indradhanush scheme. Indradhanush scheme is for vaccination of the child. All right, vaccination against 12 disease. Initially, it was vaccination against 7 disease. That is why the name was Indradhanush. But later on, it was increased to 12 disease. So today, Indradhanush covers 12 disease. All right. So Indradhanush scheme, and it will also extend Poshan scheme, POSHION, Poshan. It will also extend Poshan scheme. Poshan scheme is actually a mix. It includes midday meal scheme and it includes ICDS, Integrated Child Development Scheme. All right, so Poshan will be that. So Poshan scheme, that's called Poshan 2.0. Poshan scheme to tribal regions. Then you write second. So this is the first point where they will focus upon. Then you write second, promoting enrollment in Eklavya Model School, promoting enrollment in Eklavya Model School. So these are holistic schools with residential facility. That is Eklavya Model Schools. They have been planned with the budget of 2023, and the government says that we will promote, and it is targeted that tribal children will be given education with residential facility. All right. So Eklavya Model School with scholarship. In fact, in the first phase, 2025 of 23 to 2027, the government is planning setting up 100 Eklavya model schools all over India in the tribal region to attract tribal children to come to these schools, get good education, and so on. So that is the basic idea of developing them. Then next you write, third, coverage of forest right titles, coverage of forest right titles. Forest right titles is defining tribal rights on forest produce and asset. Defining tribal rights on forest produce and asset. ऑलराइट कि जो फॉरेस्ट के प्रोड्यूस हैं उन पे ट्राइबल्स का क्या राइट है और जो असेट्स हैं उन पे ट्राइबल्स का क्या राइट है इट विल बी वेल डिफाइंड देयर विल बी नो एरिया ऑफ कंफ्यूजन रिमेंबर वन थिंग this scheme is targeting the tribal groups which are called PVTG, particularly vulnerable tribal groups. All right, this scheme is targeting them, PVTG, particularly vulnerable tribal groups. All right, so there are 74 particularly vulnerable tribal groups in India spread over 18 states and 1 union territory. All right, that is where we are. So this particularly vulnerable tribal groups, there are 74 of them in number in India, particularly vulnerable tribal groups. Again, the announcement was made in the budget of 2023 and then the implementation happened starting November onwards. So particularly vulnerable tribal groups, PVTG, are the targeted people here. In the same point, जो ये point आप लिख रहे हैं, यहीं पे आगे लिखिए, government will also establish Van Dhan Kendra as self-help groups for tribals. Government will also establish Van Dhan Kendra as self-help groups for tribals. All right. Again, this will be that those among tribals who are slightly educated or informed can come together, maybe 20 people at least, and when you come around 20 people with a common platform, that you have a common interest, maybe everybody is going to sell a particular product, or everybody is going to do a particular business, or everybody has a particular objective to solve. So these 20 people can come together, form a self-help group, and this self-help group will be supported with funds from the government, it will be supported with technical expertise by the government, and they can do small businesses, they can take loans among each other, give loans to each other, and develop their own system, even agriculture, etc. So that is self-help group. India has at the moment more than 88 lakh self-help groups in our country that are there all over the place. So this is about adding to those self-help groups. Okay, you write next point now, you wrote 3, right? You write 4th, provision of housing facilities, to all PVTGs spread over 18 states and 1 UT. Full stop. 18 states and 1 UT. Full stop. This will be done through PM Awas Yojana. This will be done through PM Awas Yojana, AWAAS, PM Awas Yojana, rural. Alright, this will be done through PM Awas Yojana, rural, with a budget of rupees 15,000 crore. This will be done through PM Awas Yojana, rural, with a budget of rupees 15,000 crore. Full stop. The target is to provide housing for all, among PVTG, in the next 3 years. All right, then you write the fifth point. Provision of drinking water supply by extending Jal Jeevan Mission, provision of drinking water supply by extending Jal Jeevan Mission, and provision of electrification through revamped revamped power development scheme, revamped power development scheme is also included. In the same point, put a full stop and write unconnected habitations will be targeted for telecom connectivity through installation of mobile tower under Universal Obligation Fund. All right, these are the 5 points of the scheme which you must remember. They can be asked in mains also, it can be asked in prelims also, that they can ask you which are the part of the scheme. मैं कुछ information और आपको दे रहा हूँ इस scheme को लेकर, again from prelims in my mind, I mean that is in my mind. So you change the paragraph and write free education for those children, and some money will further be given to them. You change the paragraph and write the scheme has a budget of rupees 24,000 crore. The scheme has a budget of rupees 24,000 crore for next 3 years, and it will be implemented it will be implemented by Ministry of Tribal Affairs, Ministry of Tribal Affairs, with the help of state government, with the help of state government. Full stop. The data will be data regarding existence of PVTG, where are they living, what is their habitat, all right, the data related to that. So the data will be developed by Bhaskaracharya National Institute, Bhaskaracharya National Institute for Space Research, Bhaskaracharya National Institute for Space Research and Application of Geoinformatics. There is a more popular acronym for it. It's called BISAG-N. गुजरात में established है ये, and it's called BISAG-N. All right. So this is Bhaskaracharya National Institute for Space Research and Application of Geoinformatics. Again, this is mainly with prelims in my mind that I'm giving you these information. You write one more thing along with that. The scheme will be administered N. No, G. You write. Could you tell me the line I said? Yeah, the scheme will be administered by both central and state government, Again, this is from prelims point of view. Full stop. In the center, there will be a high-powered committee at the top, so in a bracket you write high-powered committee at the top, and in a bracket you write Tribal Affairs Minister as its head, It will have 8 ministries actually, तो 8 minister इसके member होंगे और जो tribal affairs minister होंगे वो head होंगे. All right, that is the idea. So tribal affairs minister as its head, close the bracket, put a comma, followed by Convergence Committee, and in a bracket you write Tribal Affairs Secretary, that is Secretary to the Minister of Tribal Affairs. So Tribal Affairs Secretary as the head, close the bracket, Tribal Affairs Secretary as its head, close the bracket, and finally Mission Starting Committee, again Tribal Affairs Secretary as the head. mission starting committee, and again tribal affairs secretary will be the head. तो सेंट्रल गवर्नमेंट में ये 3 tier होंगे. All right, there will be ministers, and then there will be secretaries, and then there will be joint secretaries and all, and this will be the 3 tier of it. After a full stop, you write, in the state government, there will be an apex committee. In the state government, there will be an apex committee whose chairperson will be the Chief Secretary of State, followed by coordination committee, under district collector, and finally block level group as in charge of PVTG habitation, under block development officer, in charge of PVTG habitation under block development officer, BDO. All right, so this is the structuring. Again, in mains you don't have to write these details, but in the prelims exam they can sometimes ask you the details. They're giving you statement that which committee is responsible and so on. So you should have these details on PM Janman. And how the scheme functions, I'll teach you in the current affairs. We'll have to wait and watch. At the moment, none of the schemes are very active in India because of the elections going on. That's just one thought process we should definitely think over. I know we are a large country and we are a diverse system, and there is difficulty of logistics. But हमें तरीका ढूंढना ही पड़ेगा, क्योंकि अभी आप सोचिए, the election gets announced in kind of March, and the model code of conduct comes into picture, April say for that matter. Elections begin from April. Now April, May till 4th June, we will not have government functioning the way it should be. Imagine in a big country and a fast moving system like ours, it results in every 5 years, kind of, 2.5 months of complete stagnation of governance. And that's a huge cost to pay. The point to understand is that, ये काफी costly होता है फिर, क्योंकि आपके सारे decisions, सारी चीजें बीच में अटकी हुई हैं, वो सब होगा इलेक्शन के बाद. और ये भी नहीं होगा कि 4 जून को इलेक्शन के रिजल्ट्स आएंगे तो 5 जून से डिसीजन शुरू हो जाएंगे. Then somebody will form the government, and then the ministries will be allocated. So take another month after that. So ranging from something like March till July, it is not going to function. और उसमें आप समझिएगा, जो सरकार बनाएंगे, they would have made the government after a grueling election campaign. So initially it won't be all cylinders blasting. ये इसलिए आपको समझा रहा हूँ, because अगर इंडिया की GDP एक साल में $300 billion ऐड करती है, मतलब एक महीने में $25 billion ऐड करती है. अगर स्लो डाउन आ गया 3 महीने का, then we don't know how much growth we are compromising. So what I'm only suggesting is that maybe we can make things a little truncated rather than having them over 7 phases and 2 months. Maybe if we can somehow find a method, and I don't know which method, but if we can somehow find a method to bring it to 1 month or maybe 25 days and conduct the elections all across, we are in a much better space. I again repeat, I understand there are logistical issues, and I understand that we are a vast system, but still we will have to find methods over a period. Technology can be of some use there to make sure we conduct things as quickly as possible also, because a large country like ours without a proper governance mechanism, or central government that is, for 3 odd months, and then add to that the uncertainty, that is an added factor, क्योंकि सब लोग डरे हुए हैं, कोई कोई इन्वेस्टमेंट रोक के बैठा हुआ है कि नहीं पहले सरकार बन जाने देते हैं तो ही इन्वेस्ट करेंगे, कोई एम्प्लॉयमेंट के लिए नहीं इशू कर रहे हैं नया नोटिफिकेशन, क्योंकि अगर सरकार बन जाए तो देखते हैं एम्प्लॉयमेंट कितना देना है नहीं, सो ऑल दैट अफेक्ट्स द इकोनॉमिक सिस्टम क्वाइट अ बिट, वी हैव टू बी केयरफुल ऑन दैट. Okay, now we write the next scheme. You write PM Vishwakarma scheme. This is an apprenticeship scheme actually. It's called PM Vishwakarma scheme. This was also announced in the budget of 2023. PM Vishwakarma scheme. Yes. In mains, they can straight away ask you to analyze these schemes to sometimes 150 words. They have even asked about schemes like there's been as direct a question as explain SLBP scheme and its impact on welfare. That is the question they had asked. So they directly ask you the scheme and ask you to talk the welfare of it. Or by chance you are writing something on tribal development, then your answer must have a Janman. By chance you are writing something on employment generation for small artisans, your answer should have a PM Vishwakarma. Understand that. All right. So one, the question can be direct. Another, use your knowledge and your information to plan your answers when you are writing various things. आप नॉलेज बेस को अपने स्ट्रॉन्ग करिए, वाइटन कीजिए, और फिर उसे बहुत जगह यूज कर सकते हैं आप इन पेपर 2, इन पेपर 3 एंड सो ऑन, इफ यू रिमेंबर दैट ओके दीज आर थिंग्स दैट आई हैव लर्नड इन द पिक्चर. ओके, इन विश्वकर्मा स्कीम यू राइट अगेन, द स्कीम was introduced from 17th September. The scheme was introduced from 17th September 2023. Full stop. It is a central sector scheme. It is a central sector scheme. Now, please keep this in mind. Whenever we use the word central sector scheme, it means that all expenditure on the scheme will be done by central government. All right, that is a central sector scheme, that all expenditure on the scheme will be done by the central government. And if a scheme is centrally sponsored scheme, then the expenditure will be shared between central and state government. All right, तो जब भी आप ये सुनते हैं centrally sponsored scheme, that means the expenditure will be shared between the central and the state government. And central sector scheme, the entire expenditure will be done by the central government. All right, I hope everybody is clear on that. मैं एक बार फिर repeat कर देता हूँ in case you missed it. Whenever you hear the word central sector scheme, the entire expenditure by the central government. For a central sector scheme, the entire expenditure by the central government. And if it is a centrally sponsored scheme, then share of expenditure between central government and the state government. तो कुछ schemes जो आप सुनते हैं, जैसे PM फसल बीमा योजना और PM Kusum and so on for agriculture, they are centrally sponsored scheme. But both the schemes that I made you write just now, PM Vishwakarma and PM Janman, they are central sector scheme. The central government is planning all the expenditure. I hope it can stay with you. Okay, you write further then, you write, it is implemented by Ministry of MSME. It is implemented by Ministry of MSME. MSME is micro, small, medium enterprises. All right, that is MSME. that micro, small, medium enterprises. I'll teach you again MSME in some detail when I'm teaching you industries in India, but that is MSME, micro, small, medium enterprises. So Ministry of MSME to provide holistic, and end-to-end support, holistic and end-to-end support. End-to-end means from one end to another end. So ranging from toolkits and training to marketing and supply. You understand that? That entire support will be given to artisans and craftspeople under the scheme. So to provide end-to-end support to craftspeople, and craftspeople and artisan engaged in (18) type of activities, engaged in 18 types of activities. And I'm giving you the name of these 18 activities. I have seen UPSC asking in the prelims from things like these. So I'm giving you the 18 activities name. Please keep that with yourself. So the activities are, you write first, carpenter, second, CARPENTER, carpenter. Second, boat maker, third, armorer, ARMOURER, armorer. Fourth, blacksmith. Fifth, hammer and tool kit maker, hammer and tool kit maker, hammer and tool kit maker. Then next, locksmith. Then next, goldsmith. Then next, potter. Then next, sculptor. Then next, stone breaker. Next, cobbler. Then next, mason, 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 राजमिस्त्री को बोलते हैं. Then next, basket maker. Then next, doll and toy maker. Then next, barber. Then washerman, tailor, and fishing net maker. All right, again, you don't have to mug up these 18 things. ये नहीं कि इसको बैठ के सुबह शाम मंत्र जाप किए. बस एक पेरिफेरल व्यू भी रहेगा. तो अगर वो तुम्हें एग्जाम में लिख के देंगे ना, इंक्लूडेड इन पीएम विश्वकर्मा और नॉट, इट विल स्ट्राइक यू इंक्लूडेड इन पीएम विश्वकर्मा और नॉट. हमें बस इतनी खबर रखनी है दैट विच वंस आर इंक्लूडेड, देन विच वंस आर नॉट इंक्लूडेड इज ऑटोमेटिकली क्लियर. सो जस्ट मेक श्योर दैट you have a peripheral understanding and you have read through him 2-3 times to make sure that if by chance somebody suddenly asks you, this is included in PM Vishwakarma, a statement, then true or false, you can judge that. All right, that is the aspect. You change the paragraph and write, the scheme has an initial budget the scheme has an initial budget of rupees 2000 crore and and a total budget of 12,500 crore. It will provide following benefits and then you write them as 1 2 3 4. So you write 1, recognition. Put a dash and write a certificate will be issued along with an ID card to recognize artisan and craft people. All right, this will be 1, identify the people that who are going to be the beneficiaries. In the same thing you write, same thing, the identification will be done over 3-step verification. The identification will be done over 3-step verification. First, verification at Gram Panchayat or local body. Verification at Gram Panchayat or local body, like urban local body is what I mean. So either it can be Gram Panchayat if you are in the rural area, if urban area then the urban local body, whichever is there. Second, recommendation by district implementation committee. And third, final approval by screening committee. All right, so first step will be recognize the people, identify them, and recognition will be done as a 3-step verification. Then you write 2, the second benefit given under this. What is the benefit of recognition? मैं इस बेनिफिट में लिखवा रहा हूं आपको कि 4 बेनिफिट हैं स्कीम के और उस बेनिफिट में से एक मैंने लिखवाया रिकॉग्निशन. ये क्या बात हुई? रिकॉग्नाइज करना कौन सा बेनिफिट हुआ? Okay, bogus. What is the benefit to the artisan if the artisan is recognized? Several other opportunities also. For example, if there is an easy loan facility, for example, if there is a proper marketing facility outside this scheme, once I am recognized, I can show my validation and take those other opportunities. Unless I am not recognized, those other opportunities will also elude me. You understand that? So that is why recognition is the key. अब सोचिए हमारा सबसे बड़ा चैलेंज क्या है? We are a country with 60 crore, 55, 60 crore people in the workforce, out of which more than 80% are in the informal sector, which means many of them are not recognized. So if you have not recognized them, how will you identify properly and distribute benefits even if you would like to? जैसे जब आप पॉलिटिकल पार्टीज के मैनिफेस्टो पढ़िए, मैं कांग्रेस पार्टी का पढ़ रहा था कुछ दिनों पहले, तो वहां लिखे दैट वी विल गिव टू द वुमेन 1 लाख रुपीस, द वुमेन हु आर इन द बॉटम 20%, and 1 lakh rupee per annum. But a big challenge will be to identify women in the bottom 20% because पहले तो एक साल लगेगा सेंसस करने में हमें. I hope it is done as soon as possible. सेंसस करने के बाद एक साल लगेगा एसईसीसी के रिजल्ट्स वेरीफाई करने में, फिर एक साल लगेगा देखने में दैट व्हाट शुड बी द क्राइटेरिया टू चूज बॉटम 20% बिकॉज इनकम कैन बी वन क्राइटेरिया बट देन एज आई टॉट यू ऑलरेडी डिप्राइवेशंस आर ऑफ अदर टाइप्स आल्सो. सो द पॉलिटिकल पार्टीज प्रॉमिस इट. समटाइम्स there is a supposedly strong leader. So the strong leader tells the people implement it. मैं implementation वाला आदमी हूँ, implement करो. जो उनके नीचे हैं बेचारे, उनको पता ही नहीं चल रहा अब implement करें कैसे, क्या करें इसका. सर तो ऊपर से तबला बजा रहे हैं कि implement करो, लेकिन मेरा information set ही weak है. So where do I implement? So what happens then to achieve the target? Lot of inclusion error. Inclusion error is those people are included who ideally should not have been, and in the process then lot of exclusion error that people who should have been included are excluded out of it. So understand this. क्या challenge क्या है आपको मैं बताता हूँ, किस बात को लेके मैं ये discussion शुरू किया मैंने आपसे. आप किसी भी welfare scheme के targeting को अच्छा तभी कर सकते हैं जब आपके targeted group के बारे में आपको ज़्यादा से ज़्यादा information हो. Unless you don't have information about targeted group, the welfare schemes cannot deliver. Because remember, the schemes cannot deliver if you implement them and then back off. You will have to implement them and live with the scheme for at least 5 to 7 years for them to deliver. आपको example देता हूँ मैं. Take a Jan Dhan Yojana. Now, before that, it is not that Jan Dhan Yojana is the first time that we are trying to create bank account for everyone. There have been several schemes in the past where we have tried using the public sector banks to create a bank account for everyone. But where does the problem come? The problem comes in lack of hand-holding. So I create a bank account for everyone, but now when I am creating this bank account for everyone, suppose for a second, I give you a bank account, you are very poor, you don't know what to do with that account, I have opened your account, now you don't know what to do with it, and I am not guiding you what to do with it. So what will happen after 6 months, 8 months, 1 year, 1.5 years? Your bank account will remain dormant because nobody is using it. 2, 3 years later, maybe you migrate somewhere else. You understand that? And that bank account is gone forever. So at least in Jan Dhan Yojana, the good thing we are doing is we are transferring subsidies into the account. We have appointed banking correspondents to train people how to use that bank account, using the Jan Dhan Aadhaar Mobile Trinity, JAM Trinity as it is called. So when you do that, you are hand holding people, you are training them. लेकिन अगर आप कहेंगे ठीक है आपको फैसिलिटी दे दी अब तुम यूज कर लो, उन लोगों के लिए इतना कॉमन नहीं है जिन्होंने इसको यूज नहीं किया जितना हमारे आपके लिए है. बस यही समझाना चाह रहा हूँ. So you need to identify your beneficiaries first of all and identify them in detail to the granular data. Only then your benefits can be reaching people. The advantage we have today in our system is that technology is towards us. So we can always use technology to make sure that identification is complete. But unless, again I repeat, we don't identify, hand-holding cannot happen, and if hand-holding doesn't happen, any good scheme goes waste. ठीक है, ये तो बुरा लगने की बात है, sociologically एक खराब बात हुई. Economics को इससे क्या लेना देना है, resource को क्या लेना देना है. अगर आप hand hold नहीं करते और एक scheme complete नहीं होती और benefit लोगों तक नहीं जाता, I'm just repeating myself in English, if you are not hand holding and the scheme is not completed and benefit doesn't reach people, then 5 years later, all these people whom you had helped and tried uplifting are back on scratch, and you will have to start afresh again using all your resources to uplift them all over again. And that's a huge burden on the state treasury. कि आप हर बार शुरू से शुरू करेंगे. So this is something that harms us or has been harming us in our policy making. कि हम policies बनाते हैं फिर हम भूल जाते हैं कुछ policy बनी थी, फिर कोई याद दिलाता है सर एक है पहले से, तो फिर हम उसका नाम बदल देते हैं कि अच्छा ये अब इस नाम से आएगा. But that doesn't help. आप सोचिए जब हम बोलते हैं aspirational districts program और अब हम aspirational blocks program करेंगे. Well, in 1971, we had a lead bank scheme where each public sector bank adopted a district. and they were backward districts of India, and they were supposed to be developed by help from the public sector bank and Ministry of Welfare. तो 71 से लेकर आज तक एस्पिरेशनल डिस्ट्रिक्ट प्रोग्राम चल रहा है. So this is something we need to be careful about कि एक प्रोग्राम शुरू किया किसी ने, अगर आप उसको लॉजिकल कंक्लूजन तक नहीं ले जाते हैं तो आप बार बार वही प्रोग्राम रन करेंगे, हर नए जनरेशन को लगेगा अब मेरे समय में कुछ नया हो रहा है. That is called the bias of immediate. अभी आपको लगता होगा ना इंस्टीट्यूशंस कॉम्प्रोमाइज्ड है इंडिया में, कंट्रोल्ड हैं, ऐसा भारत में कभी नहीं हुआ, क्योंकि आप भारत की हिस्ट्री पढ़े नहीं और अभी उम्र इतनी है कि जानते नहीं कि पास्ट में क्या क्या हो चुका है. तो आपको लगता है ऐसा हुआ नहीं होगा, ये अभी जो हो रहा है ये कभी नहीं हुआ होगा. और ऐसे ही जो लोग सरकार के सपोर्टर है, मैं बता ही चुका हूं, बोलते हैं 75 ईयर्स में कुछ नहीं हुआ. कुछ लोग सरकार से टिकट लेने के लिए यहां तक बोलते हैं कि आजादी ही 2014 में मिली. So it's both sides of the story that you have. But again, I repeat, it's always somewhere in between. There have been some good work we have done, but the challenge is, unless you keep, आप सोच के देखिए, अभी हमने ट्राइबल्स के ऊपर ये पीवीटीजी पे बात की, और 1982 में गवर्नमेंट ने लॉन्च किया था ट्राइसेम और उसके साथ ट्राइफेड. तो ट्राइसेम था जो नौकरी दिलाएगा और सेल्फ एम्प्लॉयमेंट फॉर ट्राइबल्स अलॉन्ग विथ एम्प्लॉयमेंट जनरेशन, और ट्राइफेड था एज ट्राइबल मार्केटिंग एग्रीकल्चरल मार्केटिंग फेडरेशन, दैट व्हाटएवर द ट्राइबल्स ग्रो विल बी सोल्ड बाय गवर्नमेंट इंस्टीट्यूशन ऑफ ट्राइफेड. ट्राइसेम इज डिफंक्ट नाउ एंड ट्राइफेड इज ऑन वेंटिलेटर. तो ये मैं आपको समझाना चाह रहा हूं कि आप जितना मर्जी स्कीम चलाइए, जितने मर्जी लेकर आइए. If I'm sounding like a skeptical old man, you bear with me. Old, I agree. Skeptical, I will contest. But I've seen things happening so many times, and then the false promise that it brings a point in mind that unless I have not seen it logically concluded and people upgraded, तो इसीलिए identification जब भी किसी scheme में देखता हूँ, I feel happy that okay, at least we are finding out who are these people whom we are targeting. All right. Then second point, you write, 2. Skill upgradation with basic training of 5 to 7 days. Skill upgradation with basic training of 5 to 7 days. Followed by advanced training of at least 15 days. Advanced training of at least 15 days with a stipend, STIPEND. STIPEND. Stipend is a temporary payment you do to a trainee. Alright, कोई training में है तो उनको आप payment कर रहे हैं. So with a stipend of rupees 500 per day. A stipend of rupees 500 per day. Okay, next, then you write, next point. Toolkit incentive, this is the third point. Toolkit incentive of up to rupees 15,000, 15,000. Toolkit incentive of up to rupees 15,000 in the form of e-voucher, electronic voucher. In the form of e-voucher. A voucher is like a ticket. Electronic voucher is when it is electronically issued, and voucher means you can use this only to purchase what it is meant for. All right, you cannot use it for any other purpose. So suppose if you have a toolkit e-voucher of 15,000, you can use this e-voucher only to purchase your toolkit. All right, it cannot be used for any other purpose. So with an e-voucher, at the beginning of basic training, तो जब बेसिक ट्रेनिंग की शुरुआत होगी तो 15,000 रुपीज का एक ई वाउचर दे दिया जाएगा, लेकिन उसमें एक कंडीशन है. द कंडीशन इज यू कैन यूज दिस ई वाउचर only after you have completed your basic training and going for advanced training. So when you are going for advanced training, you can now buy your toolkit up to rupees 15,000 using your e-voucher. All right, that is the basic aspect again. All right, इसमें एक बात और समझिएगा. All such schemes, I have one more actually objection to that. All such schemes should have a sunset clause. Sunset clause like 3 साल के लिए दिए गए, 2 साल के लिए दिए गए, क्योंकि कोशिश ये होनी चाहिए that we target quickly, upgrade people and take them to the next level. All right, अगर हम वो नहीं करते तो मनरेगा की तरह वो infinite हो जाता है. Right? That then it goes on. अब सोचिए मनरेगा, मैं आपको पढ़ाऊंगा अभी, but मनरेगा end of the day is what? A tacit acceptance that we can't give you good quality job. So live with this मनरेगा and please don't eat my head. You know, कि ये मनरेगा पकड़ो, मेरा सिर मत खाओ, और मैं तुम्हें नौकरी तो नहीं दे सकता अच्छी. हम लोग थोड़ा आलसी हैं, हम फैक्ट्री नहीं लगने देंगे गांव में, हम इलेक्ट्रिसिटी नहीं जाने देंगे, हम लॉ एंड ऑर्डर नहीं होने देंगे, तो मनरेगा से काम चलाते रहो. So 2007 मनरेगा I can understand, but 2024 तक अगर मनरेगा ही चलता रहेगा, then when will we take action to upgrade and upskill and give people more jobs? So that is why a sunset clause will be needed. There is an anthropology optional open session scheduled on 16th May at 4 p.m. by Sudhir sir. The venue is main building. Today is 15th, no? So tomorrow then, 4 p.m. tomorrow. So those of you who might have questions to ask on anthropology choice as an optional, you can maybe see him then. Okay, let's see this then. You write below that, next, 4th point. Basic training. No, it is issued at the beginning of basic training. It can be used only after the basic training has been completed. All right. 4th point you write, credit support is given by providing collateral-free development loans, by providing collateral-free matlab no security needed. Collateral is the security that you have to deposit for taking loan. All right, collateral-free means no security deposit. Will that mean the banks will have no security? No. Who will take the security now? The government. You understand that? That in case there is a default on the loan, then the bank is secured by the government. All right. So collateral-free. You wrote. Could you tell me the line I framed? Yeah, collateral-free development loans up to rupees 3 lakh. Up to rupees 3 lakh in 2 installments. The first installment is of rupees 1 lakh. The first installment is of rupees 1 lakh, which will be given for 18 months, 1/8, for 18 months to all those who have completed basic training, all those who have completed basic training, and do not have, who have completed basic training and do not have any default record of the past. Do not have any default record of the past. ऑलराइट, अगर पास्ट में उन्होंने कोई लोन लेके डिफॉल्ट नहीं किया है और साथ में अपनी बेसिक ट्रेनिंग कंप्लीट कर ली, दे गेट मनी 1 लाख फॉर 18 months. What does that mean? That you will get 1 lakh rupee and you have to pay it back within 18 months. All right. Change the paragraph and write the second installment. So development loans are loans which will be given to people which can be used only for purpose of their upgradation. They cannot use it for consumption purpose. As in, I can't use it to celebrate my child's marriage, etc. I will have to use it for my development purpose. Okay. Rate of? The rate of interest will be subsidized, but that will depend on case to case and bank to bank. There is no specific instruction on that. You write within that, the second installment of rupees 2 lakh will be given for 30 months. Sorry. There is, before I go further, so for 30 months, I'm answering your question in a little bit more detail. So what's happening is, government has fixed a rule that you have to give maximum up to 8% interest subsidy. It's called interest subvention. So you can give up to 8% interest subsidy or interest subvention, but no bank can give it below 5%. So in that sense, you can fix your interest rates. Like suppose there is a bank which has an interest rate of 14%, then they can give it at 6%. There is another bank which has an interest rate of 16%, they can give it up to 8%. You understand that? But the interest subvention has to be of 8% and it should never be below 5%. I'm going to make you write that also, but that is the rule. Fixed by the government. You write in that, so given for 30 months, full stop. The interest rate, अच्छा एक बात और, जिनको भी सेकेंड इंस्टॉलमेंट मिलेगा उनके लिए कंपलसरी है that they should have opted for advanced training. All right, तभी सेकेंड इंस्टॉलमेंट रिलीज होगा. All right, they should have opted for advanced training. Opted for means in the process. तो या तो advanced training complete कर चुके हो या कम से कम advanced training ले रहे हो, then only the loan second installment will be sanctioned. So first installment after completing the basic training, second installment, it doesn't need you to complete advanced training, but you must have at least opted for it and going through it. Till then you will be allowed to take this second installment of loan. I hope I have clarified myself. Okay, you write then, the interest rate will be lower than market rate by up to 8%. In a bracket you write interest subvention scheme, SUBVENTION, interest subvention scheme. जब भी इंटरेस्ट को कम करके दिया जाता है तो इंटरेस्ट सब्सिडी वर्ड यूज नहीं होता, इंटरेस्ट सबवेंशन वर्ड यूज होता है. All right, whenever the interest rate is reduced and given to people, we don't use the word interest subsidy, we use the word interest subvention. All right, you'll see this word very often in many spaces. All right, so interest subvention scheme, then close the bracket, then go further, you write, however, interest rate on loan can never be less than 5%. All right, so that is the idea that market rate से 8% कम होगा, लेकिन 5% के नीचे कभी नहीं होगा. Also remember, there is one more benefit the government is promising to promote digital transactions. मैं आपको लिखवा दूंगा, but आप समझ लीजिए पहले. So government says that if the artisan sells the product and gets a digital payment, then they will be allowed, or the government will give 1 rupee extra in their account for every digital transaction up to 100 transaction. So that means 100 rupees extra can be earned by the artisan if they insist on their payers to pay digitally. You understand that? That is again a thing to promote digital transactions. Why should we be focusing on digital transaction in these schemes? Formalization. A digital transaction will mean that it is recorded. You get a record of how people are purchasing, what money is being received. So as digitalization goes further, especially in finance, the formalization goes further. All right. आप हमेशा एक बात समझिएगा, ये इसलिए भी बोल रहा हूँ क्योंकि आप यूथ हैं और कभी कभी डिस्पॉन्डेंट होंगे, स्पेशली जो अखबार आप लोग पढ़ते हैं उसको पढ़ के. You know, that the newspaper will keep feeding you with a lot of negative news. This is a challenge, this is a problem, and so on. Always remember, a lot of it lies A, in where did we start, and B, in what culture did we create after that. And then, if that culture was, by culture I mean economic system, and then whether that economic system created vested interest groups who are taking advantage out of it. So now even if you want to change it, the vested interest groups will have their own inertia and they won't let you change it, so on. So that friction has to be managed also. So when somebody says, oh, India mein aisa dikkat hai, waisa dikkat hai, so always we have to look back that where were we 25 years back or 30 years back, where are we today? And if the direction is linearly and positive, then we can debate the speed, but we should not be debating our idea of growth. You know, speed को debate कर सकते हैं कि और जल्दी हो सकता था, थोड़ा लेट हो गया, लेकिन ये कहना कि कुछ नहीं हो रहा है या कुछ भी नहीं हुआ is something which I always keep telling people that we should be careful about. So the way we have grown in the last 15, and when I say grown, I don't only mean GDP growth. गवर्नमेंट ऑफ इंडिया जो बोलते हैं, कभी कभी लोग स्केप्टिक होते हैं, नहीं हम नहीं मानेंगे, यूएनडीपी की बात तो मानेंगे. एंड यूएनडीपी सेज दैट बिटवीन 2006 to 2019 India could uplift 415 million people out of multidimensional poverty. Now this is some number to look at, that we are pushing our way through. So what I'm only trying to teach you is that when we study schemes, when we study things, there is a skeptic inside us which tells us that maybe it will not work, or what is happening. On the ground I see so many people poor, but we'll have to compare it to what did we see the poor's living or living standard of poor's earlier, and how do we see the living standard of poor's today, and that will be a very good idea of whether we are doing well or not. हाँ, एक चीज क्या करना पड़ेगा, training of bureaucracy and legitimizing the programs by making sure that any loopholes can be covered. I'll tell you what I mean by that. Training of bureaucracy से मेरा मतलब है, अगर bureaucracy को आदत पड़ी हुई है नहीं काम करने की, especially हमारे lower bureaucracy को, तो थोड़ा भी ज्यादा काम होता है तो बोलते हैं बहुत काम करना पड़ रहा है. मैं अपने कुछ दोस्तों को देखता हूं सरकार में, बोलते हैं हमें तो सैटरडेज को भी आजकल जाना पड़ता है. जाना ही चाहिए ना. इतनी छुट्टी कैसे लोगे अगर सरकार की जिम्मेदारी ली है तुमने, वो भी एक गरीब देश में. Government is the key initiator of many programs, and if government officers choose to have a Saturday, Sunday off, and then an off on Ram Navami, and off on Eid, and off on Christmas, and off on Dashera, then the whole country goes in that off mode, no? तो अगर इतनी छुट्टियां सरकारी दफ्तर में होंगी तो काम कब होगा? और फिर जब मिलते हैं तो भी छुट्टी का ही माहौल रहता है कि जो फाइल्स हैं वो मूव नहीं कर रही होती. So that is what I call training of bureaucracy. You just have to train the bureaucracy that this is the word, and training needs carrot and stick. Carrot we are already giving by increasing the salaries, etc. Bring a stick saying there is nothing called permanent job in this world. The job can be secured and we won't fire you otherwise, but the job cannot be permanent, because permanency means that you can go lazy and we can do nothing about stopping you. You understand that? So that is a culture we need to create in India, and then only things go better. हमारे यहाँ कभी कभी सरकारी नौकरी को entitlement माना जा रहा है, जो बहुत ही dangerous है. People take it as an entitlement, that okay, I have this job and I'm entitled not to work. So that is not a good, option to go by. That is something we should always take care of. All right. because that makes things inefficient. So unless we don't call it out and we don't start changing that whole culture, we will be in trouble, क्योंकि वहीं से vested interest groups बनते हैं. That is the real challenge. जब आप कहते हैं ना पैसे वालों का देश है, कैसे बन रहा है पैसे वालों का देश? कोई तो पैसा खा रहा है उन पैसे वालों से. ये समझना ये जरूरी है. अगर कोई पैसा ना खाए पैसे वालों से तो कॉमन लोगों का काम भी हो जाएगा. लेकिन अगर मैं पैसे खा के लाइसेंस बना दूं, पैसे खा के पासपोर्ट बना दूं, पैसे खा के आधार कार्ड बना दूं, तो जो कॉमन लोग हैं उनकी वेटिंग लिस्ट का लाइन लंबा रहेगा ही, क्योंकि प्रायोरिटी तो फिर मैं उनको दूंगा जिनसे पैसे खाए. तो पैसे खाने का ही प्रोविजन खत्म किया जाए, ये समझाना चाह रहा था आपको. तो ये स्कीम्स भी बेटर रन करेंगे, बिकॉज द इंसेंटिव शुड नॉट बी व्हाट एक्स्ट्रा आई विल गेट इन इट. कभी कभी मैं देखता हूँ वो भी कहते हैं लोग, मुझे क्या मिलेगा इसमें? तुम्हें सैलरी मिल रही है उसकी. जो भी हो रहा है उससे. तो जब सैलरी ले रहे हो तो कुछ और लेके क्या करोगे उसमें? This is once we, again I repeat, overcome this, we will be able to make a more implementation wise better system. Okay, I am completing this further. You write, an amount of ₹1, an amount of ₹1 per digital transaction, up to a maximum of 100 monthly transactions, 100 monthly transactions will be credited to beneficiaries' account by Government of India. Will be credited to beneficiaries' account by Government of India. Then below that you write, there is another support government gives them. Marketing support will be provided in the form of this. Yes, marketing support will be provided. ये next point है, the fifth point of support in the scheme. Marketing support will be provided in the form of quality certification, like giving them an ISI mark, or giving them an ISO certificate, so that their product can also be a premium product that can be sold in the market. Otherwise they lose on the premium customers. So by quality certification, branding and advertisement. Full stop. In the same point you write, government will also give priority to their product. Government will also give priority to their product while purchasing through GEM portal. GEM. GEM is Government Electronic Marketplace. While purchasing through GEM portal. GEM. And GEM is Government Electronic Marketplace. Alright, that is GEM portal. Government Electronic Marketplace. So while making purchases through GEM portal, Government Electronic Marketplace. All right. और ये गवर्नमेंट इलेक्ट्रॉनिक मार्केट प्लेस है जहां से सरकार के जो डिपार्टमेंट्स हैं वो अपने परचेजेस करते हैं. सो इफ समबडी नीड्स फर्नीचर, और इफ समबडी नीड्स say clothes, or if somebody needs artisans product. So gem portal will prioritize them. And one more thing you write in that, the participants will also get accessibility to Udyam portal, UDYAM, to Udyam, UDYAM. उद्यम पोर्टल, ये उद्यम पोर्टल सरकार ने बनाया है for registration of MSME, micro small medium enterprises. So if you are registered on the Udyam portal, you are recognized as a valid MSME. All right, so that is Udyam portal. So accessibility to Udyam portal to be recognized under the category of MSME. All right, so this is on PM Vishwakarma scheme. Again, how it operates on the ground and what exactly happens, I'll let you know as I go further in this year. Now you give a heading, third. So one was Janman, second Vishwakarma, third I am saying. So you write third, steps for financial inclusion. Steps for financial inclusion. Fair enough, Subhasis. When we say steps for financial inclusion, we'll do them in silos, so one by one. So you write within that A, banking inclusion. In steps for financial inclusion, you write A, banking inclusion, and put a dash and write government has initiated Jan Dhan Yojana. Government has initiated Jan Dhan Yojana from 2015 Jan Dhan Yojana from 2015 to provide accessibility to bank account for all in the economy. Accessibility to bank account for all in the economy. सभी के लिए बैंक अकाउंट होना चाहिए. That was the idea. तो क्या करता है जनधन योजना, में आपको बता देता हूं, फिर लिख भी लेंगे उसे. Number one, it says you can have zero balance bank account. Zero balance means there is no minimum balance. You can keep your account empty also if needed. Number two, it says that all those who are maintaining a regular balance in their account, a minimum of 3,000 or above, for 1 year continuously, will qualify to receive up to rupees 10,000 of overdraft facility. So overdraft facility is that you can withdraw more than what you have deposited. As in, suppose I have 2,000 rupees in my account, the overdraft facility allows me to withdraw 10,000 rupees. It's like a loan that I take on my account. And of course there will be an interest charged, but I have a facility to withdraw from my account itself. It also says that all those who have a Jan Dhan account will be given free life insurance. No premium will have to be paid. Life insurance will come along with that. And it also says that all those who have a Jan Dhan account will be provisioned with a banking correspondent. इनको बैंक मित्र बोलते हैं वैसे. So banking correspondent, these will be government appointed people who will train the customers or the account holders into how to use their account, like withdrawal of money, deposits, transfer to some other account. They will be trained by them, and they will be trained via the use of Jandhan Aadhaar Mobile Trinity. That your Aadhaar is linked to your Jandhan and your Aadhaar is linked to your mobile. So that becomes the identification part. And mobile phone banking will mean that you don't have to go to your bank to do the transaction. You can do it via the mobile phone, and that Jam Trinity can attract people. And the one I was criticizing a little while back, that then that will not happen, that people will not know what to do with the account. They will be trained into how to use the account. All right, that is the basic idea behind Jan Dhan Yojana. Do I believe you understand that? Okay, so we put it across. You write, under JDY, when I say JDY, I mean Jan Dhan Yojana. All right, under JDY, government has provided zero balance bank account to all adults in vulnerable group. Full stop. It will also provide an overdraft facility. It will also provide an overdraft facility of up to rupees 10,000 to those account holders who maintain a regular minimum balance of rupees 3,000 or above, in their account. In the same thing you write, all account holders will get the benefit of free life insurance. All account holders will get the benefit of free life insurance. And one more you write, the account holders will be supported by banking correspondent who will use Jam Trinity, JAM, Jandhan Aadhaar Mobile. All right, that is Jam, Jandhan Aadhaar Mobile, Jam Trinity, to assure that basic training is provided by assistance to use bank account. After a full stop you write, it is implemented by Ministry of Finance. It is implemented by Ministry of Finance, full stop, till 31st January 2024. The data I'm giving you is from the budget speech of the finance minister. All right, so till 31st January 2024, it had more than 55 crore beneficiaries, more than 55 crore beneficiaries, and it had mobilized more than rupees 2 lakh crore of small savings, more than rupees 2 lakh crore of small savings through these accounts. All right, this is again a factor to keep in mind, that Jan Dhan account is also leading to mobilization of savings. If you recall, yesterday when we were discussing impact on growth, we were discussing this point. Okay, I'll just make you write a heading right now. आप 10 minute enjoy कर लीजिए. ठीक है. You write just a point within that. The first was banking inclusion. You write 2, credit inclusion. Second, credit inclusion. And within credit inclusion, you write another sub point, PM Swanidhi scheme, SVANIDHI, PM Swanidhi scheme. All right, PM Swanidhi, SVANIDHI. This is street vendors Atmanirbhar Nidhi scheme. Street vendors Atmanirbhar Nidhi scheme. So we will begin from here, as I see you tomorrow 8 o'clock again then. Thanks a lot, all of you. And thank you everybody online. I see you tomorrow at 8 o'clock. I'm leaving you a little early today. I have something to attend actually. Tomorrow I will be there after your class. You can always ask your doubts from me. Thank you all of you again.